we're going to kick off today with betting big business on digital health. This will start with StartUp Health is here to announce their annual insights report. And we're going to follow that by Dr. Kvedar's here to talk about 5 trends building an Internet of Health Things business. We have things such as 3 CEOs, each individuals. We have from startup to successful post-IPO to worldwide connected healthcare company coming to sit down for incredible one-on-ones and hopefully some great insights for you. Good conversation. And then we'll wrap up the business section with a look at what the international frontiers are looking like and how that kind of fits into digital health and healthcare. Moving on, employer wellness, employer health. As a matter of fact, there was a huge acquisition this week. We even had Derek Newell. Okay. Derek Jeter talking about his acquisition. So we had Derek Newell here from Jif talk yesterday. So Jif was acquired for a nice acquisition all around employer wellness, huge. And we're even going to talk about what are the technologies being used in the enterprise, in office, in surgical trainings, and things like that. Megatrends. Megatrends is a big bucket because there are so many great megatrends in digital health. Everything from caregiving, don't want to miss anything, VR, artificial intelligence. We have some incredible demonstrations towards the end of the day that you definitely will not want to miss. Wearables we will cover. And one of the cool sessions that you should really make sure if you step away to come back for is around messaging and how messaging has incredible business opportunities to influence the healthcare industry, and something that I would have thought texting made no, anyway, I was kind of very interested by it, and I think you will be too. I think the desert's starting to pay off in my mouth. Last, how a Trump administration will affect digital health. Hot topic. Yes, we don't know. Lots of unanswered questions. But we put together a killer panel about this, and people highly involved in the government. And one of the things we talked about was, should we do this session? Answer was definitely a resounding yes. And the reason being is that we know his appointees, we know what's going, we know what his cabinet's going to look like. So I think it'll be a lot of hypotheticals, but some very, very, very interesting stuff. Hopefully something good and tweetable, as they say. So that should be great. Now, after that, we have Dan Monroe here, who wrote Casino Healthcare, and we're going to be the first 100 people that show up for that. We're going to have a book signing after that, because Dan actually is moderating that final Trump session. And then finally, the most exciting part of the whole day is cocktail. We're going to all meet at the Dorsey afterwards and just grab a cocktail together. It's very informal. It's not a giant hosted event. At the same time, I get requests all the time. I was like, where can we all meet? How can we meet each other? So I figured, invite everyone to come drink with me. And that's the plan of the day. So without further ado, I kind of want to kick off the program if anyone doesn't have any major questions. Except we work with incredible sponsors. They support so much of what we do. Many are on the floor, exhibit floor. I hope you have a chance to come visit them. Pretty incredible exhibits this year. Exciting new consumer offerings. We spend a little bit more time on the sort of medical, clinical side in this room, but the exciting part is downstairs. You get to see a lot. There's cool gadgets, but there's very cool technologies, and hopefully some new partnerships come out of that. Another list of some of our elite sponsors. So thank you to them from all of us. So Oh, that's me. So I'd like to invite to the stage Paulina Hanin. She's the Academy Director of StartUp Health, and she has been with them since 2012. She is extremely passionate advocate for health entrepreneurs and is here to reveal their annual Insights report. So let's welcome her to the stage and kick off this day.
Thank you. It should be on. Yeah. Good morning, everybody. It's hard to see who's actually here, but congratulations all on making it to day 2 and to actually being here. I know that that takes a lot when you find yourself in Las Vegas and lots of toys to play with. So what we wanted to do today was give you guys a sense of how big the bets in digital health actually are, and to give you a perspective from StartUp Health, where we have a pretty big purview. I want to thank the folks at CES and Jill for having us here. It's really exciting for us to be able to unveil our final numbers for 2016. This report is actually not available yet and will be released next week, so you guys are getting a pretty big sneak peek into what 2016 looked like in terms of the funding that has gone into this ecosystem. So I want to give you a little bit of a sense in terms of what StartUp Health is all about and the lens that we look at this ecosystem through. So StartUp Health is organizing and supporting a global army of health transformers. These are entrepreneurs who are all on a single and focused mission to improve the health and well-being of everyone in the world. And so we actually think that it is going to be entrepreneurs who are going to solve the various challenges that exist and that are prevalent within our industry. So we think that because of the entrepreneurial spirit, we can achieve 100 years of progress in 25 years. So StartUp Health launched in 2011, and we're only on our 6th year in, and we believe that this can actually be achieved. For those of you who have seen us speak in the past, this slide might look familiar. We've been saying since about 2011 and 2012 that this is a once-in-a-lifetime moment, that the conditions are aligned to reimagine healthcare and health and well-being. And that has not changed. That hasn't wavered. There is still an urgency because chronic disease, aging, and costs are rising. That urgency has not gone away. There is still an impetus and a catalyst through healthcare reform and through various regulations that have forced various stakeholders to change their business model. It is still the golden age of entrepreneurship, as Todd Park had alluded to back in 2010, that now's the time to start a business, and there has literally been no better time to start a business in healthcare than today. Technology is prevalent, given that all of you are on your various phones and mobile devices, and this health revolution is happening on a global scale. And so what we've developed is a new model for transforming health based on a health transformer mindset, the codified behaviors and conditions for an entrepreneur. We've organized a global army of now 179 companies and 350 entrepreneurs. We give them a lifetime of coaching to support them on their mission to transform health, give them access to partners, a media platform that helps amplify their voice, a data-driven tech platform to help them figure out what's working, what's not, and we do it with a team of 30 full-time people. So this support for every entrepreneur in the room, for every stakeholder in the room, is for the lifetime of the entrepreneur. And it's important because every single entrepreneur who is in this space is committed for the long term. You don't just get in and get out within healthcare. It's important to all of us to be able to have this mindset to be all in. And the entrepreneurs are all in. What you will see from StartUp Health in 2017 is a reorganization of the way that we talk about health. So we've traditionally talked about it in terms of sectors, right? Big data, population health, patient and consumer experience, and you'll see that through our report. But we're going to change that conversation. We're going to change that conversation because every single entrepreneur wants to make an impact, and a long-term impact. So we're actually going to be reorganizing our portfolio and even this ecosystem around the top 10 health moonshots that are changing the world today. Access to care, driving costs to zero, curing disease through data, cancer moonshots, women's health, children's health, nutrition, brain health, mental health, and longevity moonshots. I encourage every entrepreneur to start to think in this way. What impact can you make in 10 years, in 25 years? How will you make the world different? And so this has started to make itself known in terms of the funding that has actually started to take place within this ecosystem. In 2010, there was about $1 billion that was invested in this space. That is no longer the case today. $8.1 billion went into digital health space in 2016. $8.1 billion. And there's no sign of slowing down. We're seeing that the fourth quarter was on par with 2014, the year that digital health actually broke out. The number of deals has started to increase again as a result of new seed and Series A rounds that are starting to be raised. These new business models are starting to increase demand, and investors are betting. So what we've seen on a year-over-year basis is that overall the funding has increased. Q4 had a slight dip in December, but that's okay. The markets tend to be volatile, and Q4 does tend to be slightly lower than the other quarters as well. So we'll be interested to see in terms of how this funding actually shakes out for January itself. The top 10 largest deals included a lot of international companies as well. These top 10 deals represented close to 35% of the total deal value that went into the ecosystem in 2016. And what you'll note is that many of these deals are focused on the patient, on the consumer, on improving the actual consumer experience. And this is different than what we've seen in previous years, where a lot of the capital that went into this space was focused on big data and workflow and population health, was focused on the backstage of the hospital or of the payer. These companies are putting the power back in the hands of the patient. So we'll be interested to see in terms of how this actually plays out in 2017. But this has actually translated into the total dollars as well. Patient, consumer, and wellness are clearly the top two winners in terms of the most active markets, with close to $3 billion and $1 billion going into each of those systems. Each of those sectors, rather. And big data and analytics, which used to be this kind of a poster child for digital health innovation, has started to waver a little bit in terms of the types of dollars that are coming into the space. In fact, in terms of the amount of time that it takes to raise between a seed and a Series A with big data and analytics, it's lower than some of the other markets there. And this goes to show in terms of the types of maturity within this space as well. Patient and consumer experience, though it does look to be the youngest, given that most of the investment this year has been in the seed and Series A stage, is actually starting to mature into the mid-stage growth as well, alongside with some of those big data and workflow deals as well. So if you are planning on raising a round, if you're an entrepreneur in the room, you should know that money is available. We thought probably in around the 2013, 2014 timeframe that there's going to be a reduction in terms of the number of deals within the seed and Series A phase. I mean, how much can you actually invent? What else is there to do? But it doesn't seem to be slowing down. In fact, 2/3 of the deals that occurred within last year have been within the earlier rounds of seed and Series A. But what's even more encouraging is the fact that the mid-stage deals are starting to increase as well. So the market is starting to mature, and investors are starting to bet on the companies that are actually doing the work. So close to 30% of deals have been between Series B and Series C, which are mid-stage deals. This goes to show that the market is starting to mature, and for the entrepreneurs in the room that are able to prove their significance in the ecosystem, there's capital for you. I mentioned before in terms of the time that it takes to raise a round. For the entrepreneurs that are starting to raise capital this year, if you just raised a seed round and you are going to be going to your Series A, you should note that it's going to take you about 15 months to get that deal going. In fact, we've actually seen this year that the volatility in terms of the time that it takes to raise a round has actually increased. So if you were raising money in 2015, it would take you between 8 and 13 months to raise your Series A. That number has increased to 8 to 22 months. So just be cognizant in terms of that as you're planning your capital, your cash spend for the oncoming year. No surprise here in terms of where the activity actually sits. San Francisco and the Bay Area continue to be the top earners in terms of cash that is flowing into the ecosystem from investors, with fairly close followership by Boston and New York. We've seen this year that LA and San Diego have started to make a much bigger splash than in the past within the digital health sector. So who's actually putting some of this money to work? It's been interesting for us to follow this trend because over the last couple of years, we've seen such a prevalence of investment come from corporations and come from big business that is actually betting within this ecosystem. GE Ventures, a corporate venture firm, not a farm, has actually been the top investor for 2 years running. Year before that, it was Qualcomm. It's interesting to see that it's these stakeholders within the system that are actually putting dollars to work for the entrepreneurs. We see obviously that organizations like Blue Cross Blue Shield or Intel are starting to place bets within this space as well. That it's important for them to be in the know in terms of what is actually happening on the transformational side and the innovation side of this industry rather than just being an acquirer. And entrepreneurs seem to be responding to that as well. They're coming to these organizations for capital. And what you'll also see on this slide in terms of the top investors is that there's some non-traditional ones as well. Organizations that may not have invested in digital health in the past are actually starting to put their dollars to work. So organizations like First Round or 500 Startups, or these aren't necessarily traditional healthcare investors, but because of the way in which digital health is expanding, you're getting some non-traditional health, or you're getting some non-traditional investors to invest in this ecosystem as well. But these aren't the only investors that are coming into this space. If you're an entrepreneur, you want money, those top 10 investors are not the only ones who are going to give it to you. There's over 800 unique investors that have put their dollars to work in this space. 800. These are firms. These are entities, organizations. These aren't angel investors. This is important for every single entrepreneur to note, that you have to speak to a lot of people. You have to make your impact known. And there are people who, when they feel the impact that you're making, they will put capital to work. What's even more interesting is not only do you have a lot of these dabblers in terms of the organizations that are actually putting capital in, but you have people that are, you have many organizations that are actually starting to double down. You see an increase within the blue bar chart of the number of entities that are starting to place 2 deals or 3 deals a year. And that is starting to increase on an annual basis. And what's been great about that is that this gives validation to this ecosystem as well. It's not a flash in the pan. It's not that you had a lot of buzz happening in 2011 and 2012, and then all of a sudden investors are sitting on the sidelines. You have a lot of investors that are not only doubling down, but are starting to enter into this space as well. So there's definitely capital to be had within this space, as we've discussed before. So with that, I want to close on a couple of different thoughts. So we talk a lot in Startup Health about a concept called being batteries included. So for an entrepreneur in the room, that, and for actually everybody here, that you bring energy to the table versus draining energy out of the room. And so for the entrepreneurs, we want to make sure that as you're going out and raising capital, that you're starting to think about yourself in this fundraising process in a way that is all about feedback. And for the investors that are here in the room and those that are evaluating the companies that are starting to come into this space, bring energy to the table and have a zero tolerance policy of non-batteries included people around you. And that is pretty easy to see within CES. So they have a fairly batteries included place. So with that, I want to thank you very much for listening to this session, and we'll turn it back over to Joel. Thank you.